from Physio and Fitness Clinic. I wanted to show you some of the treatment that I may do with clients who are coming in with base of foot pain, or if base of foot stiffness is part of a injury that's higher up the kinetic chain. So, for example, someone's knee pain may be because they're so tight through their plantar fascia, it's not allowing them to roll through with their walking or running style particularly well. So I might treat this area of the body, even though the pain's actually located further up. So in through the base of our feet, from the heel and stretching all the way up into the metatarsals is what's commonly referred to as our plantar fascia, okay, which is basically a thick fascial structure, so very, very thick structure that helps to maintain the arch of our feet. An important muscle that also helps with the arch of the foot is called the flexor hallucis longus, so FHL, which that's super important for our big toe movement. So you can see here with this client, as I'm lifting up through here, you can see that bowing in through her plantar fascia, and that's because that FHL in through here has lifted up the arch of her foot. So in people who are presenting with me and having a very flat foot, certainly building up strength and stability in through this FHL is very important for those clients. So, but what the treatment technique I'm going to show you today though is actually how I would release that. So this would be in somebody who is experiencing tightness of the FHL, affecting their ability of the midfoot to roll nicely through movement pattern. So the treatment technique is basically utilising my thumb, and then as I'm finding the tight spot in through the FHL, so in through here, I can feel it flicking underneath my thumb there. And once I've found that spot, I'm then going to mobilise her big toe up and down like that into what's called dorsiflexion. All right. So clients will often find that this is particularly painful while I'm doing it, but it feels good at the same time, like it's a good pain. And so if I'm feeling like I'm getting a reasonable range of movement, which for most clients is about 90 degrees, we want them to be able to lift up, then I can also hold that there and do some strokes in through here. And so that'll be getting that FHL, but it will also be getting the inside section of that plantar fascia in general as well. Okay, so you think all these muscles, they're all quite small, but they all kind of stick together a little bit, and that's what the plantar fascia is it becomes basically all of those smaller muscles of the foot connecting together to create a really solid base for us to walk and run through. Okay, and so this is how I would treat tightness of that area. Thank you.